Let me take you to a place where pain and healing dance together in the flickering light of primitive fires. We're travelling back 7,000 years, long before hospitals existed, before metal touched human flesh, before anyone understood why blood flows or how bones mend. We're going to witness something that should have been impossible: brain surgery performed with nothing but stone tools and raw human determination. You're standing at the entrance to a limestone cave in what will someday become France. The Ensisheim cave stretches into darkness behind you, its walls polished smooth by centuries of human habitation. Smoke drifts from fires deeper in the cave system, carrying the scent of burning wood and something else. Something metallic that makes your primitive brain recoil with instinctive fear. Inside the cave, a man lies motionless on a bed of animal hides. His breathing comes in shallow gasps. 3 days ago, he was hunting mammoth with his clan when a massive bull caught him with its tusk, sending him flying into a limestone outcrop. The impact left a depression in his skull the size of a clenched fist. Bone fragments press against the soft tissue beneath. Without intervention, he'll be dead before the next full moon. His family has already begun preparing for his funeral. The cave's healer studies the wounded man with eyes that have seen this kind of injury before. Her scientific name would be Homo sapiens neanderthalensis, which should have been everyone's first clue that Stone Age medical school admission requirements were somewhat flexible. She moves with the confidence of someone who has spent decades learning the geography of human anatomy. Her tools lie arranged on a flat stone beside the patient: obsidian blades, sharp enough to split hairs, bone needles carved from mammoth ivory, stone drills that have been worked to surgical precision. There's something deeply unsettling about watching someone drill through a living person's skull with a piece of sharpened flint. What happens next challenges everything we think we know about primitive medicine, prehistoric intelligence, and the lengths to which humans will go to save each other. Watch as she begins the procedure that archaeologists call trepanation, the deliberate drilling of holes through the human skull. This technique, refined through generations of desperate experimentation, represents one of humanity's first systematic approaches to surgical intervention. The evidence scattered across European cave sites tells us that Stone Age surgeons were performing successful brain operations thousands of years ago before the pyramids were built. The healer places her stone drill against the patient's skull and begins the slow, precise work of cutting through bone. Each turn of the drill removes tiny flakes of calcium, creating a circular groove that deepens with methodical patience. The process will take hours. The patient remains conscious throughout, held down by clan members whose job is to prevent movement that could drive the drill too deep into brain tissue. There is no anesthesia, no antiseptic, no understanding of bacterial infection or surgical sterilization. Only knowledge passed down through generations of healers who learned their craft by treating injuries that would have been fatal without intervention. The success rate, as revealed by archaeological analysis of trepanned skulls, was surprisingly high for a procedure performed under conditions that would horrify modern surgeons. The patient's skull finally yields to the persistent pressure of the stone drill. A circular piece of bone, roughly the size of a modern quarter, comes free in the healer's hands. Beneath lies the soft grey tissue that houses consciousness, memory, and everything that makes this injured hunter recognizably human. Pressure that has been building for days suddenly releases. The patient's breathing deepens. His eyes, which have been unfocused and clouded since the accident, begin to track movement around the cave. The clan members who expected to be mourning his death find themselves witnessing his return from the edge of extinction. The healer cleansed the surgical site with boiled water and honey, substances that modern medicine recognizes as effective antiseptics. She covers the opening with a thin membrane made from animal tissue, creating a biological barrier that will protect the exposed brain while the surrounding bone grows back. archaeological evidence shows that many patients survived multiple trepanations, suggesting that Stone Age surgical techniques were refined enough to allow repeat procedures on the same individuals. Standing in that cave, watching firelight flicker across the faces of people who have just witnessed a medical miracle, you begin to understand that the distance between prehistoric and modern medicine is not as vast as we like to imagine. The tools were primitive, but the understanding of human anatomy, the surgical techniques, and the post-operative care all demonstrate sophistication that rivals anything available in the ancient civilizations. What you've witnessed represents the beginning of a surgical tradition that spans millennia, connecting Stone Age healers to modern neurosurgeons through an unbroken chain of knowledge, innovation, and the fundamental human drive to heal rather than simply accept death. The man who was dying 3 hours ago is now sitting up, accepting water from his wife, asking about the mammoth hunt that nearly killed him. He will live to see his grandchildren. The circular scar on his skull will mark him for the rest of his life as someone who journeyed to the edge of death and returned with the help of Stone Age medicine that was far more sophisticated than anyone imagined possible. But trepanation was just the beginning. Stone Age surgeons developed techniques for setting bones, extracting teeth, amputating infected limbs, and performing procedures that required anatomical knowledge gained through generations of careful observation and experimentation. The caves of Europe are filled with evidence of medical innovation that preceded written history by thousands of years. How did people with no formal medical training, no textbooks, no understanding of germ theory or human physiology, develop surgical techniques that saved lives and relieved suffering? What drove them to attempt procedures that must have seemed impossibly dangerous? And what can their success teach us about human ingenuity, medical innovation, and the lengths to which we will go to save each other? The story of Stone Age surgery is written in bone and stone, preserved in caves where healers learned their craft through trial and error that literally meant the difference between life and death. Let me take you forward in time to a frozen valley 15,000 years ago, where survival depends on decisions that would make modern emergency room doctors reach for their liability insurance. The hunt started at dawn. You're following a band of Cro-Magnon hunters as they track a massive woolly mammoth across the ice-covered landscape of what will someday become Germany. Skilled predators who have developed techniques for bringing down animals that weigh as much as modern trucks. The mammoth they're pursuing stands 11 feet tall and carries enough meat to feed the entire clan through the harsh winter months ahead. Its curved tusks sweep the ground as it searches for vegetation beneath the snow, each ivory spear longer than a grown man and sharp enough to punch through rib cages with casual efficiency. The hunters move with coordinated precision, using the terrain to approach from multiple directions. They've done this before. The stone-tipped spears they carry represent generations of technological refinement, balanced for throwing accuracy and designed to penetrate the thick hide that protects mammoth vital organs. What happens next unfolds with the brutal randomness that characterizes most hunting accidents throughout human history. The lead hunter, a man whose scarred hands testify to decades of dangerous encounters with Ice Age megafauna, launches his spear with perfect technique. The weapon arcs through the frigid air and strikes the mammoth's flank, penetrating deep enough to trigger the massive creature's pain-driven fury. Instead of fleeing, the wounded animal charges directly toward the hunting party. The hunter tries to dodge. His feet slip on ice-covered rocks. The mammoth's tusk catches him in the midsection, lifting him off the ground and slamming him against a boulder with enough force to shatter stone. The impact echoes across the valley like a gunshot. When the dust settles, the hunter lies motionless in the snow. His left leg bends at an angle that defies human anatomy. Jagged bone protrudes through torn skin, gleaming white against the red snow spreading beneath him. Modern trauma surgeons would immediately recognize this as a compound fracture of the femur, an injury that kills through blood loss and infection when left untreated. His hunting companions face a decision that will determine whether their friend lives or dies. They can abandon him to pursue the wounded mammoth, securing food for the entire clan, but condemning their companion to a slow death in the snow. Or they can attempt a medical procedure using tools and techniques that exist nowhere in their cultural memory except in the hands of the clan's bone setter. They choose to save their friend. The bone setter arrives as the sun reaches its highest point in the winter sky. She's an elderly woman whose gnarled fingers have spent decades learning to read the geography of human anatomy through touch alone. Her toolkit consists of materials that would seem laughably primitive to modern orthopedic surgeons. Straight branches for splints, strips of mammoth hide for binding, and a collection of stone tools sharp enough to cut through skin and muscle when necessary. She examines the injury with the methodical thoroughness of someone who understands that mistakes will be measured in human lives. The broken bone has torn through major blood vessels. Without intervention, the hunter will bleed to death within hours. But the procedure she's about to attempt has never been described in any medical textbook, recorded in any surgical manual, or taught in any institution of learning. Everything she knows about treating compound fractures has been learned through trial and error in situations exactly like this one. The first challenge is stopping the bleeding. She presses handfuls of moss against the wound, a technique that modern medicine recognizes as effective hemostatic therapy. The moss contains compounds that promote blood clotting, turning what could be fatal hemorrhage into manageable seepage. Next comes the delicate work of realigning the broken bone. This requires strength, precision, and anatomical knowledge that can only be acquired through years of handling similar injuries. She grips the hunter's leg above and below the fracture site, then pulls with steady pressure until the bone fragments slide back into proper position. The sound of bone grinding against bone echoes across the winter landscape. The hunter, conscious throughout the procedure, bites down on a piece of mammoth hide to prevent himself from screaming loud enough to attract predators. His clan mates hold him steady as the bone setter works, their faces grim with the understanding that they're watching a procedure that could save their friend's life, or kill him through shock and blood loss. Archaeological evidence shows that Stone Age bone setters achieve success rates that rival modern emergency medicine under field conditions. Skeletons recovered from Ice Age sites display healed fractures with proper alignment, suggesting that prehistoric surgeons understood principles of orthopedic treatment that wouldn't be formally documented until thousands of years later. The bone setter wraps the realigned fracture with strips of hide soaked in animal fat and pine resin. This creates a flexible cast that will harden as it dries, providing the rigid support necessary for proper bone healing. She splints the leg using straight branches that she shapes with stone tools, crafting a device that immobilizes the fracture while allowing the patient to be transported back to camp. The entire procedure takes less than 2 hours. When it's finished, the hunter who seemed certain to die is alert, responsive, and asking about the mammoth that nearly killed him. His leg will heal over the following months, leaving him with a permanent limp, but allowing him to return to hunting and provide for his family. Standing in that frozen valley, watching Stone Age surgeons save a life using nothing but empirical knowledge and improvised tools, you begin to understand that the boundary between primitive and sophisticated medicine is far less clear than modern assumptions suggest. The bone setter had mastered surgical techniques refined through generations of practice, learned how to transform ordinary plant and animal products into effective medical devices. Her patient will walk again because she understood principles of fracture treatment that modern orthopedic surgeons spend years learning in medical school. But bone setting was only one component of Stone Age surgical expertise. In caves across Europe, archaeologists have discovered evidence of procedures that make compound fracture repair seem simple by comparison. Operations that required cutting through living tissue, manipulating internal organs, and understanding human physiology at levels that challenge our assumptions about prehistoric medical knowledge. Our journey through Stone Age medicine takes us deeper into human ingenuity, where survival depends on techniques that would make modern surgeons pause in admiration. Picture yourself 12,000 years ago in the mountains of what will become Switzerland. You're crouched beside a glacial stream where a hunting accident has just torn through a young hunter's abdomen like a spear through fabric. His intestines glisten in the morning sunlight, exposed through a gash that runs from his rib cage to his hip bone. In any other era of human history, this would be a death sentence. The injury happened during an encounter with a cave bear that had been raiding the clan's winter food stores. The bear's claws, each one the length of a human finger, caught the hunter across his midsection as he tried to drive his spear through the animal's chest. The wounds are deep, precise, surgical in their devastating efficiency. Blood pools in the rocky depression where he fell. His breathing comes in shallow gasps that send ripples across the crimson surface. Modern trauma surgeons would recognize this as multiple organ laceration with massive internal bleeding, the kind of injury that kills within hours, even with advanced medical intervention. The clan's healer arrives as the hunter's skin begins taking on the greyish tint that signals impending death. She's a woman whose scarred hands tell stories of a lifetime spent repairing human bodies under conditions that would challenge any medical professional. Her toolkit consists of materials that seem impossibly primitive for the procedure she's about to attempt. Bone needles carved from mammoth ivory, thread made from animal sinew that has been processed until it's fine enough for delicate tissue work, obsidian blades ground to surgical sharpness, plant medicines that serve as primitive antiseptics and pain management. What happens next represents one of humanity's earliest experiments in internal surgery. The healer begins by cleaning the wound with boiled water that contains extracts from willow bark and pine needles. She works quickly but carefully, removing debris and blood clots that could lead to infection. The real challenge lies deeper. The bear's claws have torn through multiple layers of abdominal tissue, creating wounds that must be repaired in precise sequence to prevent internal bleeding and organ failure. Think of it like reassembling a complex machine while the parts are still in motion. She starts with the deepest tissue layers, using the bone needles to thread sinew through muscle and fascia that holds internal organs in place. Each stitch must be positioned with anatomical precision that can only come from years of experience treating similar injuries. Too loose, and the wound will reopen. Too tight, and the tissue will tear. The stitching technique she employs demonstrates understanding of surgical principles that wouldn't be formally documented until thousands of years later. She creates overlapping suture patterns that distribute tension across healthy tissue rather than concentrating stress at individual stitch points. The thread spacing follows mathematical relationships that modern surgeons learn in medical school. Layer by layer, she rebuilds the hunter's abdominal wall, muscle tissue, subcutaneous fat. Finally, the skin itself, sewn with stitches so fine they're barely visible to examination. The entire procedure takes hours of meticulous work under conditions that would test the skills of any surgeon. The hunter survives. Within weeks, he's walking around camp, helping with daily tasks, planning his return to hunting activities. The scars across his abdomen mark him as someone who journeyed to the edge of death and returned through Stone Age surgery that saved his life, when all conventional wisdom suggested he should have died. But wound suturing was only one component of prehistoric surgical expertise. The techniques these healers developed for closing internal injuries would lead to even more sophisticated procedures. Standing beside that glacial stream, watching thread and needle transform fatal wounds into healing scars, you realize that the boundary between primitive and advanced medicine is far less clear than modern assumptions suggest. Our journey through Stone Age medicine continues deeper into human inventiveness, where the next procedure will test everything these healers had learned about pain, precision, and the limits of what human bodies can endure. We're travelling even further back now, to a time when dental problems weren't inconveniences, but death sentences waiting to happen. 9,000 years ago, in the mountains of what will become Pakistan, you're witnessing something that shouldn't exist. A procedure so advanced, so precisely executed, that when archaeologists first discovered the evidence, they questioned whether ancient humans could have developed such sophisticated techniques. The patient is a middle-aged woman whose left cheek has swollen to twice its normal size. An infected molar has been causing agony for weeks, radiating pain through her skull like lightning strikes. The tooth has abscessed, creating a pocket of infection that threatens to spread to her brain and kill her within days. Her clan's tooth puller studies the problem with eyes that have spent decades learning to read dental geography. His toolkit spreads across a flat stone, flint drills no thicker than pine needles, copper-tipped extraction tools, and obsidian blades sharp enough to section tooth enamel. What he's about to attempt represents one of humanity's earliest experiments in precision dentistry. The procedure begins with drilling, raw drilling through living tooth enamel using stone tools powered by human hands. The drill bit, carved from mammoth ivory and tipped with crushed quartz, cuts through the infected tooth with methodical persistence. Each turn of the drill removes tiny fragments of enamel and dentin. The sound echoes through the cave like fingernails on stone. The patient, held steady by clan members, bites down on a leather strip to avoid drawing cave bears from the surrounding forest. There is no Novocaine, no nitrous oxide. Pain management consists of plant medicines that dull sensation without eliminating awareness. Everything depends on the tooth puller's speed and precision. The drill finally penetrates the tooth pulp chamber, releasing pressure that has been building for weeks. Infected material drains from the opening like pus from a wound. The immediate relief is visible in the patient's relaxed facial muscles, but the procedure is far from finished. Now comes the delicate work of cleaning the infection from inside the tooth. Using instruments carved from bone and shaped like tiny spoons, the tooth puller removes infected tissue from the pulp chamber. Think of it as archaeological excavation inside a space smaller than a pea, where one wrong move destroys everything. The level of precision required seems impossible given the primitive tools available. The drill holes are perfectly circular, the depth precisely calculated to reach infected tissue without damaging healthy tooth structure. When the cleaning is complete, the tooth puller fills the cavity with a mixture of tree resin and ground minerals that hardens into a durable restoration. This primitive filling material has survived 9,000 years of geological time, testament to the sophistication of Stone Age dental chemistry. The entire procedure takes most of a day. When it's finished, the woman who arrived in agony is able to chew solid food without pain. The infection that threatened her life has been eliminated through dental techniques that seem to be ages ahead of its time. But some dental problems require more drastic solutions. The next patient is a young hunter whose front tooth was shattered during a mammoth hunt gone wrong. The broken root has become infected, creating an abscess that makes eating impossible. Extraction is the only option that will save his life. The tooth puller positions his copper extraction tool against the damaged tooth and begins the careful work of loosening it from the jawbone. He rocks the tooth back and forth with controlled pressure, gradually breaking the ligaments that hold it in place. Too much force and the tooth will shatter, leaving infected fragments embedded in the jaw. Too little and the extraction will take hours of painful manipulation. The tooth finally yields with a wet, sucking sound. It comes free in the tooth puller's hands, root intact, bringing with it the infected tissue that has been poisoning the patient's system. The extraction site bleeds freely until packed with moss that contains natural clotting agents. Archaeological sites across continents contain evidence of dental procedures that demonstrate remarkable sophistication. Tooth extraction, cavity drilling, and even primitive orthodontics that corrected dental alignment problems. These techniques were developed through trial and error in situations where failure meant death from infection or starvation. The woman with a filled tooth will live for another 30 years, the restoration holding firm throughout her lifetime. The hunter with the extracted tooth will learn to eat effectively despite the gap in his dental arch, adapting to his new oral anatomy with the resilience that characterizes Stone Age survival. Standing in that mountain cave, watching precision dentistry performed with Stone Age tools, you begin to understand that the development of medical expertise follows patterns that transcend historical periods and technological limitations. Pain creates innovation. Necessity drives precision. The human drive to heal pushes the boundaries of what seems possible with available resources. But dental procedures, challenging as they were, paled in comparison to the next technique in our journey through Stone Age surgery. A procedure so radical, so seemingly impossible, that when archaeologists first discovered the evidence, they questioned whether it could have been performed by prehistoric humans. The amputation of infected limbs using nothing but stone tools and human determination. Sometimes the only way to save someone is to cut away the parts that are killing them. Our journey takes us now to the oldest evidence of amputation surgery ever discovered. 31,000 years ago, in a cave on the island of Borneo, where a child's infected arm is about to make medical history. The boy is maybe 11 years old. 3 weeks ago, a hunting accident crushed his left forearm against a limestone outcrop, shattering both bones and tearing through the major blood vessels that supply his hand. The wound has festered despite every treatment the clan's healer knows. Green infection spreads up his arm like poison in water. The smell of rotting flesh fills the cave. Without intervention, the infection will reach his heart and kill him within days. With intervention, he might survive as the first documented case of intentional amputation in human history. The surgeon examining him faces a decision that will define the boundaries of Stone Age medicine. She can attempt to save the arm and watch the boy die from sepsis. Or she can remove the infected limb and hope he survives a procedure that has never been attempted by anyone in their cultural memory. She chooses to cut. The operation takes place at dawn, when the boy's strength is highest and the cave's lighting optimal for precision work. The surgical team consists of the lead healer and 4 assistants whose job is to control bleeding, manage pain, and prevent the patient from moving during the procedure. The tools arranged on a flat stone represent the cutting edge of Stone Age surgical technology. Obsidian blades sharper than modern surgical steel, bone saws carved from mammoth ribs, copper needles for vessel ligation, plant medicines that serve as primitive anesthetics and antiseptics. The amputation site has been selected with precision that demonstrates sophisticated understanding of human physiology. The cut will be made through the lower third of the forearm, above the infected area but below the elbow joint. This preserves maximum limb length while ensuring complete removal of diseased tissue. The procedure begins with a tourniquet made from braided mammoth hair, tightened around the upper arm to control bleeding during the operation. The pressure is carefully calibrated to stop arterial flow, without causing tissue death from prolonged oxygen deprivation. The surgeon makes a first incision through skin and muscle tissue, working in layers to expose the bone beneath. Each cut is deliberate, controlled, guided by anatomical knowledge that exists nowhere except in the minds of practitioners who learned their craft through life and death experimentation. Blood loss is controlled through techniques that wouldn't look out of place in a modern operating room. Major vessels are tied off with sinew thread before being severed. Bleeding points are sealed with hot stone cautery that burns flesh but prevents hemorrhage. The surgical team works with coordinated efficiency that suggests extensive practice with similar procedures. The bone saw comes into play when soft tissue has been cleared away from the amputation site. The tool, carved from mammoth rib and serrated with flint chips, cuts through living bone with methodical persistence. The sound echoes through the cave like wood being split with an axe. The boy remains conscious throughout the procedure, held steady by clan members who understand that movement could cause fatal complications. His pain is managed through plant medicines that dull sensation without eliminating awareness. Everything depends on the surgeon's speed and the patient's endurance. The infected forearm finally separates from healthy tissue. It comes away in the surgeon's hands, taking with it the source of infection that has been poisoning the boy's system. The amputation site is cleaned with boiled water and honey, then covered with animal membrane that will protect exposed tissue while healing occurs. The entire procedure takes less than 3 hours. When it's finished, the boy, who seems certain to die from infection, is alert, responsive, and asking for water. The fever that has been consuming him for weeks begins to break as his immune system focuses on healing rather than fighting overwhelming infection. Archaeological evidence from this Borneo site shows that the boy not only survived the amputation, but lived for many years afterward. The bone healing patterns around the surgical site indicate complete recovery with minimal complications. He adapted to life with one hand, learned to use tools effectively, and remained a productive member of his community. This represents the oldest known case of successful surgical amputation in human history. Standing in that Borneo cave, watching stone tools transform fatal infection into manageable disability, you witness the birth of surgical techniques that would be refined and transmitted across generations of healers. Knowledge that formed the foundation for every medical advance that followed. But amputation was the most radical procedure in the Stone Age surgical arsenal. These techniques, developed through desperate necessity and refined through generations of practice, represent the upper limits of what human ingenuity could achieve with primitive tools and empirical knowledge. The story of prehistoric surgery isn't just about individual procedures or techniques. It's about the fundamental human drive to heal, rather than simply accept death, to push the boundaries of what seems possible with available resources, to save lives when conventional wisdom suggests that survival is impossible. The boy with one arm will grow up to become a skilled toolmaker, using his remaining hand to craft implements that help his clan survive. His survival proves that disability doesn't mean inability, that human adaptation can overcome almost any physical challenge. Our journey through Stone Age medicine ends where it began, with the recognition that the distance between primitive and sophisticated healthcare is measured not in tools or technology, but in knowledge, determination, and the willingness to attempt the impossible when lives hang in the balance. The last Stone Age surgeon died thousands of years ago, but their techniques live on in every operating room across the modern world. Now, imagine standing in a contemporary hospital where a neurosurgeon prepares to drill through a patient's skull to relieve intracranial pressure. The tools have changed: titanium instead of obsidian, electric drills instead of stone. But the fundamental technique remains identical to what that Neolithic healer performed in her limestone cave 7,000 years ago. The principles of wound closure developed by prehistoric surgeons guide every stitch placed by modern doctors. The anatomical knowledge they gained through generations of desperate experimentation forms the foundation of current medical education. Their understanding of infection control, pain management, and post-operative care represents the beginning of an unbroken chain of medical innovation that connects Stone Age caves to modern hospitals. Archaeological sites across continents continue revealing evidence of surgical sophistication that challenges our assumptions about prehistoric capabilities, healed fractures with perfect alignment, trepanned skulls showing multiple successful procedures, dental work that demonstrates precision rivaling modern techniques, amputation sites with bone healing patterns that indicate complete recovery and long-term survival. These discoveries force us to reconsider the narrative of medical progress as a linear advancement from primitive to sophisticated. Stone Age surgeons weren't crude practitioners stumbling toward medical knowledge. They were skilled professionals who developed techniques through systematic observation, experimentation, and refinement across generations. Their success rates, as revealed by archaeological evidence, compare favourably to medical outcomes achieved centuries later by practitioners with access to metal tools, written knowledge, and formal training. They saved lives when saving lives should have been impossible. The one-armed boy from Borneo grew up to become a master toolmaker. His adapted techniques for crafting implements with a single hand were so effective that other clan members adopted his methods. The woman with the filled tooth lived for 3 decades after her Stone Age dental procedure. When archaeologists examined her remains, the resin filling was still intact, having provided functional restoration for her entire remaining lifetime. The hunter who survived compound fracture repair returned to hunting mammoth within months of his surgery. His healed leg, slightly shorter than the original but perfectly functional, carried him across Ice Age landscapes for another 20 years. These stories represent a systematic approach to medical care that prioritized healing over resignation, innovation over tradition, and hope over despair. Their techniques spread across continents through networks of knowledge transfer that preceded written communication by thousands of years. Surgical innovations developed in European caves appeared in Asian burial sites within centuries. Dental procedures perfected in mountain valleys were practiced in coastal settlements, separated by vast distances. This suggests that Stone Age medical knowledge wasn't limited to individual practitioners or isolated communities. It was part of a broader human tradition of healing that connected diverse populations through shared understanding of anatomical principles and surgical techniques. Modern emergency medicine owes its existence to lessons learned in prehistoric caves. Trauma surgery protocols follow decision trees first developed by healers who had to choose between attempting dangerous procedures and watching patients die from treatable conditions. The triage systems used in contemporary hospitals prioritize patients using criteria established by Stone Age surgeons who understood that some injuries required immediate intervention while others could wait. The tools have evolved beyond recognition, but the fundamental questions remain unchanged. How do you stop bleeding? How do you realign broken bones? How do you remove infected tissue without causing more damage? How do you manage pain during procedures that must be performed without anesthesia? Stone Age surgeons answered these questions through methods that modern medicine has refined, but never fundamentally replaced. They understood that healing requires not just technical skill, but also courage, determination, and the willingness to attempt procedures that conventional wisdom suggests are impossible. Close your eyes and let yourself drift back through the millennia we've travelled together. Back through amputation surgeries and dental procedures, through wound suturing and bone setting, through trepanation techniques that opened skulls to save lives that seem beyond saving. Feel the weight of all that accumulated knowledge settling into your consciousness like sediment in still water. Tens of thousands of years of medical innovation carried forward by practitioners who learned their craft through life and death experimentation, who developed techniques that saved lives when death seemed certain. Sleep well, knowing that every medical advance in human history traces back to Stone Age caves where healers refused to accept death as inevitable, where innovation was born from necessity, and where the fundamental drive to heal overcame every obstacle that primitive conditions could place in the path of human ingenuity. Dream of the surgeon's hands that learned to read anatomy through touch alone, of the patient's courage that endured procedures without anesthesia, of the communities that developed the first medical traditions. Sweet dreams, inheritor of Stone Age medical wisdom. May you rest knowing that the techniques keeping people alive today were pioneered by healers who worked in caves lit by firelight, using tools carved from bone and stone, guided only by empirical knowledge and the unshakable conviction that human life was worth preserving at any cost.